Welcome to Group 10's video for CGN Course 5710, Advanced Nurse Leaders as Educators. I'm Liz. I'm going to start by introducing our group members and their roles in this project. I have been assigned the role of facilitator, which means that I make sure that everyone has a chance to contribute. I helped with this by organizing our video plan into a document where each group member could sign up for tasks. Haley is our chair. She makes sure that we achieve our overall goals by keeping in touch with everyone in the group and assigning tasks as needed. Sam B is our timekeeper. She keeps us on track, letting us know about milestones, and she is coordinating our video recording as well. Christina is our scribe, so she records information for the group. She helped write down our initial ideas during our planning session in seminar weekend 1. Anita and Cody shared the role of resource investigator. They make sure that we have the tools we need to reach our goals. They both help tremendously with the content and demonstration video. Last but not least, Samantha W. is our sharer. She shares new concepts with us via resources and PowerPoint teaching ideas. She also shares content with other groups via this video. Now, Haley will introduce the topic of our project.
Our dilemma is that pediatric patients are often improperly prepped and restrained during the vaccination process. It is important to properly administer vaccines because improper administration of vaccines can cause injury to not only the patient, but the healthcare worker. It also prevents the vaccine from offering optimal protection. Positive experiences for both the parent and the child during injection helps promote trust in healthcare providers. Pain during vaccination is linked to a development of needle fears and subsequent healthcare avoidance behaviors such as non-adherence with vaccine schedules. For these reasons, it is important to properly prep and restrain our patients. And now Liz will talk about our learning activity.
So in order to complete our learning activity successfully, we need to understand our audience. Our learners are intended to be novice nurses who are administering injections to pediatric patients in a clinical setting. Mazzero's transformative learning theory is based off the idea that people change their views of the world, aka learn, when they are faced with a disorienting dilemma. As Haley discussed, our topic of pediatric injections and proper holding techniques can be difficult, especially for new nurses. So knowing this, we want to provide the opportunity for novice nurses to think critically about the proper procedure for pediatric injections and restraint. Our teaching activity will guide our audience through Kolb's learning cycle, starting with the concrete experience, allowing for reflection and abstract conceptualization, then ending with active experimentation. Our active learning strategies include a visual demonstration, time for discussion and reflection, and a teach back activity. So without further ado, here is Group 10's teaching activity.
So thank you all for joining us today for Pediatric Injections, Techniques for Administration and Restraint. The learning objectives for today include the pediatric preparation and restraint during vaccination and why it's important and what's wrong with the current clinical setting and what we can do to improve it. Then the relevance and application in practice, what your responsibilities are as a provider, the proper preparation, process, and techniques for pediatric injections, followed by the education that you should provide to both parents and the patient. And then following a brief demonstration, you'll have active practice and you'll practice the technique yourself with a partner, with the dolls you've been provided, and then we'll follow that up with peer feedback. And finally, you'll end with reflection on today's lesson and what you've learned. Now I will turn it over to Christina to talk about the provider responsibilities.
So as nurses, it's our job to explain the process to the patient and the parents. We will review the supportive techniques with the parents, in which Haley will discuss in the next slide. We'll demonstrate it with using a doll when possible, and we'll encourage distraction techniques. We'll implement comfort measures, and we'll also remember to be safe. If the situation is unsafe, such as when the patient is being overly combative, then we will decline to provide injection. And next will be Haley to discuss the proper administration.
So first and foremost, hand hygiene is important. Wash your hands with gel or soap and water. Clean the injection site with an alcohol swab in a circular motion, starting from the inside going to the outside. Throw the swab away and allow the site to dry for several seconds. If you're giving an IM injection, bunch the muscle with your non-dominant hand. With your dominant hand, insert the needle at a 90-degree angle to the muscle. Push the plunger down and inject entire contents and do not aspirate the needle. Remove the needle and throw the whole syringe into a sharps container. For a sub-Q injection, you will use your hand to pinch a piece of fatty tissue, inject the needle at 45-degree angle, and again, throw the entire syringe away once the contents are administered. Never recap a needle or try to separate it from the syringe. At the end, do hand hygiene and inform your patient to monitor for adverse reactions for the next 15 to 20 minutes. And now we will go to parent and patient education for Cody.
So the parents will be given information by the nurse. So they'll be notified of why the vaccine is necessary. They'll be given the benefits and the risks, such as making sure that the patient doesn't get the disease. And the risks and consequences for declining the vaccine could be no admittance to public schools and additional costs for later in case they do get the disease. Next, we'll go to Cody.
Parents should be encouraged to hold the child during the injection. This is known as supportive holding. Sitting up tends to be more effective than laying down. For vastus lateralis injections, the caregiver's arm should embrace the child while the child's legs are secured between the caregiver's legs. In the two pictures, you can see the mothers displaying a supportive hold for the two children. For the picture towards the left, the older child, the mother is embracing the child and preventing extremity movement of the upper limbs for a deltoid injection. For the picture of the mother embracing the infant/toddler, the mother has the child's arm restricted by her arm and has the child's feet firmly anchored between her thighs, leaving room for the vastus lateralis injection of the child. Supportive holding or a parent's embrace during an injection can serve as a comforting hold from the parent. It can also serve as a prevention method towards injury of the child or healthcare worker, steady control of and exposure of the injection site, and also serves as a way for a parent to comfort their child. And now to Anita to talk about distraction techniques.
Some distraction techniques that a nurse could use while performing injections on a pediatric patient include smiling while making eye contact, using humor, which has actually been shown to be the most effective, and it would be a good idea to reward good behavior after the visit, possibly with a small toy or a snack. Also, thermomechanical stimulation during vaccination through the use of a buzzy device has also been strongly associated with child-reported pain. And now I'll pass it over to Haley to talk about reducing pain.
Pain from vaccine injections is common and is the main concern with hesitancy across the lifespan. To reduce pain, give the most painful vaccines last, such as Prevnar and MMR vaccines. Promote breastfeeding during vaccination to soothe the child. Sucrose solution and juice can be used to do the same. Use local anesthetics only in children who are extremely fearful, but keep in mind that lidocaine creams are most effective on subcutaneous injections and require application up to an hour before the procedure. And now Anita will walk us through proper administration technique.
So in this first video, first use an alcohol wipe to clean the site, then administer the injection using the proper techniques. If the patient is calm, you could just sit them up and perform the injection like this one. In this second video, you'll see what technique to incorporate if the patient is not as calm and compliant. The caregiver could embrace the child and secure the patient's legs in between their legs.
So now that you've learned all about the proper procedures and techniques, and seen a demo on how to actually do the techniques, now it's your turn. So please pair up and practice with the dolls that you've been provided, both the process of delivering an injection and the proper way to restrain a pediatric patient. So take turns demonstrating the proper form and procedure, and then be aware of what you're doing, where your arms and legs are, how you're holding the doll, and look at your partner and see what they're doing as well. And then after this, you will reflect on the technique, why it works, what you've experienced in your real life experiences and in the clinical setting, and then what you've experienced in this practice exercise. And then finally, we'll ask you to provide feedback to each other. So what were you doing correctly? What can be improved? How can you implement this at your facility and teach others so that more people are using the correct procedure and techniques as they're working with their pediatric patients? And then ultimately, what have you learned from this lesson and this activity? We'll give you a few minutes to go ahead and do all that. And once you're done, thank you so much for joining us today. We appreciate your time, and please feel free to reach out if you have any questions.